In this demonstration, we'll be talking about the structures of the external ear, the middle ear, and the inner ear. So we can break up the ear into these three components when we're learning about their anatomy. And I do want to make note that the basic anatomy we're covering today is just scratching the surface. For example, when I was taking medical school anatomy at University of Toronto, we had 4 separate lectures talking about the ear, how sound is produced, balance, and so it can be quite complicated. So with that, let's start our discussion of the external ear. So in terms of external anatomy, the auricle, or sort of literally means ear-shaped portion of the ear, helps to sort of funnel and channel sound into our external ear canal. So when you're studying these models, many individuals might get this canal confused with the external canal, but remember that this is sort of deep head, right? And we talked about the opening to this structure when we were talking about the structures of the deep head. So this is actually the pharyngotympanic tube or the eustachian tube, and associated with the auricle is your external ear canal, okay? The external canal is going to be separated from our middle ear by the tympanic membrane, okay? And this has quite a lot of flexibility and is actually really highly vascularized. So if it is damaged, say from a really loud sound, you're listening to music too loud at a concert, that can heal itself. And you can also perforate it again if tubes are being placed in the ears, and that will heal, but it is a little bit painful. We have 3 tiny little bones that are within that middle ear canal. Okay, and again, this model is not to scale. It's sort of quite large, but our ear ossicles themselves are collectively smaller than the size of a dime. Okay, if you can see those examples there. And the first one, which is firmly embedded within the tympanic membrane, is called the malleus. Okay, so it's going to be firmly associated with the tympanic membrane. So then vibrations coming in through your external ear canal will hit that membrane, rapidly vibrate that membrane, and then cause the malleus, which is embedded and associated with it, to vibrate. It's then going to pass along those vibrations to the incus, which is the next of our tiny bones. And it sort of creates a chain, right? The incus is associated with our last of the ear ossicles called the stapes. And the stapes actually looks like a little saddle. And I can show you that here. Again, it's sort of associated with our inner ear. You can ignore that. But it's this little saddle-shaped or stirrup-shaped bone here, okay? And it's that bone that sits atop what's called an oval window, which will rapidly send those vibrations into the fluid-filled cavity of our inner ear, okay? Our inner and middle ears are embedded within this petrous portion of the temporal bone. So remember, it is tough like rock, right? Petrous meaning rock, but it is quite porous for all of these structures to reside. Again, they're all very small, and you have to do some dissection, like as shown here, cut away of the temporal bone to see, for example, the structures in the middle and inner ear. So associated with that stapes here, we've got the oval window, which is again that entry point, sort of a membrane between the middle and the inner ear. And we can start to see some of our structures that make up our hearing and organs of balance, right? So for example, if we take a look at the posterior aspect or intracranial aspect, so imagine the cranial nerve is coming off of the brainstem, heading through the internal acoustic meatus. It would then split off into our vestibulocochlear nerve, okay? And this is going to provide balance and hearing, right? So we can see this little snail shell type shape. This is called the cochlea. This is where sound is produced. We're not going to get into that in this video, but you'll cover it in your lectures. And the vestibular system here that has our vestibule as well as semicircular canals, and these are all fluid-filled with endolymph and perilymph, and have tiny little sort of otoliths, little rock sort of type structures that again help us keep our balance.